everyone, I am Kimberly, the 5-Minute NP. The 5-Minute NP was born out of my belief that small, incremental changes can drastically change the trajectory of your life. Our genes do not have to determine our lifespan. My goal through this podcast is to act as a roadmap that bridges the gap between knowledge and action, leading to you living your healthiest, happiest, longest life. Welcome to the 5-Minute NP podcast. Hello, everyone. Welcome to the 5-Minute NP podcast. In this episode, I am joined by Dr. Fabio Stefano, the CEO of PROMEDX Innovations Incorporated, which is a sports injury and wellness center. He is the creator of Dr. D's supplements. He is a chiropractor, Tumeric expert, and author of the book, The Power of Turmeric. He joins me to discuss the effects of chronic inflammation, its symptoms, and how lifestyle and turmeric play a significant role in its prevention and treatment. He shares the many health benefits of turmeric, including its role in cancer prevention, in hormone regulation and menopause, and the prevention of hot flashes and other associated menopausal symptoms. We also discuss the significance of vitamin D, the supplementation of vitamin D plus K, D deficiency, and why we need this supplement. He shares the difference between other supplements and his Polyshield technology associated with his supplements. He also gives much needed information on hemp seed oil, its benefits, and why it's a good idea to start supplementing. Further, who should not be supplementing with any of these supplements such as turmeric, vitamin D plus K, and hemp seed oil. Excellent information to interview, and I am so excited to share his knowledge and work with all of you. Don't forget to like, share, and subscribe to the podcast. My goal for this podcast is to help improve your health, life, and longevity. Thank you for being here. Enjoy this episode, and welcome to the 5-Minute NP podcast. Hi, Dr. Di Stefano. How are you?
Very well. And yourself?
I'm doing good. Thanks for talking today.
My pleasure.
I thought we would just start out talking a little bit about your background and what you do and what led you down the path that you're on.
Okay. Well, I'm a chiropractor and acupuncture provider as well. I've been practicing over 17 years now. I run a wellness center in the Greater Toronto area. And this has sort of been my goal for many years, to bring many disciplines together to help treat not just acute but chronic pain patients, which has actually been a very keen interest of mine, since I graduated, just because it seems to be a more difficult type of condition to treat when it comes to chronic disease. Mm-hmm. So, I've worked with many health professionals in the past, and we can all agree now that this chronic pain or chronic disease phenomenon goes back to inflammation. So everything I do in the clinic and outside of the clinic really focuses on how do we battle this inflammatory response. Mm.
Have you yourself ever experienced chronic pain, or did it just kind of something you kept seeing show up?
Well, it's a great question. So what really expedited this whole process of really strengthening my interest in this field is I lost my mother in my most grueling year of chiropractic school. One thing that really stuck with me is when her oncologist said to me, "Your mother's full of inflammation, and in your studies, focus on inflammation." So after she passed, I worked with her oncologist for about 6 to 7 months doing research with him. Before this whole meeting and going more in depth with this inflammatory theory, we thought inflammation has to be the result of and not the cause. Mm. And so from that point forward, I made it sort of my mission to really focus on the inflammation as a root for chronic pain and disease. And so that's really, increased my interest and my studies into this inflammatory phenomenon.
Mm. It's interesting. The reason I started kind of doing this is because, my last year of NP school, I was full of inflammation. Now looking back, I'm like, I was just a complete mess. I had, joint pain all over, severe back pain. I was getting back injections. I mean, I'm in pretty good health always. So that was really shocking for me to be experiencing that. And as soon as I got out of school, all of these things we're going to talk about, the lifestyle aspect of it, I was just a mess. As soon as I got out of school, I started getting things changed up my lifestyle, but I also started taking turmeric because I'd heard from a patient, a couple patients about it. So I'm looking forward to talking about that. But you are so right. Inflammation, we don't even realize it, but it totally affects everything in our body. And once we start making those small changes and correcting it, it's very treatable.
Yes, exactly. And that's one thing. I mean, look at the World Health Organization years ago made a great statement, and they basically had stated that prevention is key, and prevention is a lot more affordable, and it's more sustainable if again it's reactive as opposed to being proactive. And I made that a big part of my practice to really instill the preventative aspect or protocol in my patients, and that as long as we control inflammatory levels, then we can really help mitigate a lot of these symptoms and progression of disease as well.
So true. We always are talking about.
And so, in addition to my,
go ahead.
Yes. Oh, sorry. I mean, this is what led me to my product line of everything, including our very own, superior or elevated absorption turmeric supplement, because of the inflammatory components that we've been seeing with most of these conditions, like fibromyalgia, rheumatoid, and so on and so forth. And so everything that we produce now focuses on decreasing inflammation.
I thought we could kind of talk about inflammation in itself, because it's always talked about. If you could just talk about, acute inflammation in our body's natural immune response, and then move into what we're kind of talking about, more of the chronic inflammatory response, and what happens, what this leads to.
Very good question. And I think that's the biggest misconception, amongst the public is they don't understand what inflammation is. They think it's just swelling, right? Well, I don't have inflammation, so I'm not going to treat it. The most common is acute inflammation, as you know, whether it's injury or infection or trauma. Acute inflammation is good because that's how we heal. And, the immune system is triggered. Something has happened to the body, so it sends these inflammatory mediators to really help heal the injury or infection or what have you. It's only when it becomes out of control. And so when you have this low-grade persistent inflammation, when the acute inflammation doesn't shut off, where the immune system becomes overactive and it just continues on, that's what leads into chronic pain and chronic inflammation. And so the one thing we explain to our patients is, control the acute inflammation right away so it doesn't become this repetitive chronic cycle.
What's causing the chronic inflammation? Like, what are some things that lead to chronic inflammation?
Yeah, excellent question. So going back to the acute inflammation, where if that's not taken care of, well, then that'll lead into chronic inflammation. But not just, we use injury and infection as an example, but we know that lifestyle factors, for example, food triggers such as sugar or saturated fats or processed foods, inactivity, all these things in conjunction can really lead to an inflammatory lifestyle and keep you on that low-grade persistent inflammation, which then gets out of hand and then can give you disease or other symptoms associated with it.
Even stuff like being overweight or obese can lead to inflammation, right?
Absolutely. Because anything that causes stress on the system will trigger the immune system to react. And so we all know autoimmune disease very, very well. And so what does that mean? Well, your body's attacking itself. Why? Because it sees a threat. So obesity, yes, does cause a lot of stress in the body with associated comorbidities, such as diabetes and high blood pressure, cholesterol. These are all things that can trigger the immune response, and the cycle just never shuts off.
And what else? Like, I was thinking about, in my case, it was stress.
Right.
Poor sleep, all of those combination of things was what led it to me.
Right.
What are some signs that we have chronic inflammation?
Yeah, excellent signs. So there's many. There's the cardinal signs when you look at achy muscles and joints, fatigue, abdominal discomfort, and that's one thing that really people can understand or wrap their heads around is that there is a connection between the gut and inflammation. The vagus nerve, for example, is that controls inflammation. So, proper gut health. So if you have abdominal discomfort or irritation, these are also signs. People that get sick often, right? Or have fevers often. These are all signs, not just your typical musculoskeletal or muscle and joint discomfort, headaches, migraine. These are all signs of inflammation. And so, and it's also a sign that the immune system is always fighting something. And so this is these are the early. You can take these as early signs, and the sooner you treat it, the better it is for you.
Yeah. What do you feel like is most important when you're, starting to target inflammation? Maybe some lifestyle tips or what we should be doing, to start trying to get this under control. I mean, prevention is always obviously better than the cure, but once we're at that point, what should we be doing?
Yeah, excellent question. So, and I want to go back to the stress factor as well. As you can imagine, what's happened over the past year and a little bit with COVID is the stress levels have gone up exponentially, and also sleeplessness as well. And so we want to try to minimize that as much as possible. It's not always easy, but the going back to lifestyle changes is increasing exercise, right? Keeping yourself hydrated, decreasing, bad food choices, improving your nutrition, fruits and vegetables, lots of antioxidants. And so really we should be shifting to more of an anti-inflammatory lifestyle, including anti-inflammatory food regimen as well, the polyphenols and so on and so forth. So these are all things that we can do to make drastic changes in our lifestyle choices right away. Yeah.
The sugar, we hear about constantly and the processed foods. So why, people, it's hard these days. It's everywhere, food's everywhere. Like, how is that creating inflammation in our body just by eating these foods and consuming sugar?
Well, sugar, glucose, that does set off a reaction where first of all, your body has to work harder to store glucose. And so we have to think of that anything that we consume has to go through the liver, get filtered by the kidneys. And so the nicer you are to these organs, and the liver really is the most important organ in the body when it comes to filtration. A lot of inflammation stems from there. So if you have foods like sugar or any other saturated fats or processed foods, the liver has to work much harder to break down these foods and substances. And so that in itself can lead to inflammation. But sugar has been shown to create an immune response, which then leads to more inflammation. Mm-hmm. So you look at diabetics, well then, that's whether it's type 1 or type 2, there's always a small inflammatory component there. And pancreas has to work harder releasing insulin as well. And so there's this vicious cycle. And so that it really has to do with the trigger of the immune system. And cytokines, as we know, which is the signaling proteins, is that they go up as well with sugar. And so these cytokines, I'm sure you've heard of the cytokine storm. A lot of these different foods, including sugar, can increase cytokine levels, triggering the immune system to attack. And that's what causes starts the inflammatory cycle.
So if I come to you and I say, what do I need to eat? Should I be eating, is meat okay? There's so many different things. Like I've heard, like red meat, processed meat, that leads to inflammation. Is that true? And should we be avoiding that?
And it's a very hot subject these days, with red meat. And I would say, no, you don't have to eliminate it. I think minimize it, to once or twice a week, because, it still has some good nutrients in it as well, including your iron and things that you can get elsewhere. But I would say limit it. And so red meat also has prostaglandins, which can increase inflammation as well. So everything in moderation. When you have these drastic dietary changes, eliminate everything. Well, no, everything in moderation. I'm not a big believer of deprivation. It has to be a balanced diet, where I think that's another issue is that you have these not just patients, but people in the public that make these drastic dietary changes or these fad diets, well, that in itself can create inflammation or stress in the body. So you sort of have nice mixture of fruits and vegetables, a little bit of red meat, fish, chicken, and I would just limit it to the red meat. And things like red wine, for example, and alcohol, limit it as well, because the sugar and that in itself, alcohol can create inflammation as well. It's just really everything in moderation. In addition to that, I mean, we know that there's certain things that you can't get in your food. I know I keep going back to turmeric, but I became a big believer of turmeric earlier on in my career. When I was studying inflammation, turmeric kept popping up as nature's most powerful antioxidant and anti-inflammatory. So, and eating it isn't the same as taking a supplement, because you'd have to take 5 times as much root or powder to meet the same requirements as a capsule, as a concentrated capsule.
I'm so glad you brought that up, because I was going to ask you about that. A lot of times we try to get everything from our food, as opposed to taking a supplement. So I wanted to know the difference. If we could just take this, the spice and put it in something, if that was as effective for us as a supplement.
Most common question. And so that's what led me to my book. I wrote a book called The Power of Turmeric, sort of the Coles Notes version of the backstory of turmeric and why we need to take a turmeric supplement. Turmeric in its raw form is poorly absorbed. It's a very big molecule. It's fat soluble. People add black pepper to it, and I know we'll get to that as well. That black pepper is supposed to increase the absorption, which it does, but it's not the best choice. What we found, it's how you really extract the turmeric. So, for example, with our supplement here, we've seen this ultra bile turmeric. It's based on 9 human trials, and it's based on how the turmeric is extracted, and not just curcumin. And curcumin, which is the most active component in turmeric, represents only 3% of the root. So what we've done is not just with this supplement, but other highly concentrated supplements. It's how they extract all of the nutrients out of the root, and by doing this, you're increasing bioavailability or absorption, because the molecule becomes smaller. Now you have both the water and fat soluble component easier in the system, and it gets absorbed a lot faster. It's all more efficient for the system as well. With raw turmeric, I still add it to my diet. I sprinkle it on my food, put it in my shake sometimes, or other dishes. But again, you're not getting the same amount of absorption, because you have to eat a lot more, unless you eat it every day and 2-3 times a day. So taking 2 or 3 capsules per day would be fine, and you're getting the suggested requirement.
Can we take too much?
It's very hard to take too much turmeric. So very, very little side effects. The only caution that we really state with all of our turmeric supplements is, if you're on blood thinners, just ask your medical doctor, because it is a natural blood thinner. That's the only concern. There are a few patients or consumers who have reported some gastric discomfort. Other than that, you can go 10,000 milligrams of turmeric and still not have any side effects.
Wow. I was going to ask you if anybody should not be taking it. So that brings up, is there anybody else besides those on blood thinners that should avoid it?
Yeah, anyone who's prone to kidney stones, bile duct obstructions, anyone who produces too much acid, even with reflux disease. But that's more of a discomfort type of case, right? It's not detrimental. But for some patients, I mean, we probably have 2% of patients who report any gastric upset or abdominal discomfort. Other than that, I think the biggest caution is blood thinners.
Okay.
And this is how it prevents heart disease and other cardiovascular disorders, is that it helps to increase the blood vessels, the blood vessel size, vasodilation, and it prevents plaque buildup as well.
I was going to ask you, curcumin, you hear that.
Yes.
Is that a separate supplement, or is that it's really literally, I've seen it both ways. So I wanted you to clear up that confusion.
Again, another excellent question. Till this day, we have patients say, well, I'm already taking curcumin, but I need to take turmeric. Turmeric is the plant, and in the root of turmeric exists curcumin, which is the most active and most powerful component. The difference is that you have supplements that only have curcumin, which only represents 3% of the root, which is fine. But we discovered with new technology, new science, that there's more than just curcumin. There's over 200 nutrient-rich bioactives in the root. So with our supplement is that we've extracted everything. Curcumin is known as a curcuminoid, and then there's non-curcuminoids, and that's what we've done. We've combined things like, for example, protein and other vitamins and minerals that exist in the root. So turmeric and curcumin really are the same. It's just curcumin exists in the root of turmeric.
Okay.
So
in
those of
your
you who are
supplement,
taking, what's that?
oh, go ahead.
Sorry,
In your supplement, it's got it's really strong on that aspect of it.
Yeah. So we discovered that, why waste the rest of the root of turmeric root. We discovered that there are very, very good other nutrients here, and again, over 200 of them that should not be discarded. And so you look at these supplements that say 95% curcumin. Well, they're only benefiting from curcumin, which is fine because it is very therapeutic and very medicinal. But when you combine the entire root nutrients, you're getting a much better therapeutic effect. Mm-hmm. So really, what we call our supplement is a full spectrum turmeric supplement, because you are benefiting from all the nutrients, and that's the difference. Yes.
Okay. Do we take it with food?
Usually after a meal. Okay. It doesn't have to be, but we found our product is based on a randomized controlled study on rheumatoid patients, and we found that it was best taken after a meal for better absorption. And with these rheumatoid patients who are on medication, the objective was, well, how can we minimize symptoms, inflammation and pain, but also minimize medication dosage? And after 90 days, there was almost a 75% decrease in inflammatory markers and pain by taking 2 to 4 capsules, which is really between 500 and 1,000 milligrams per day.
That's pretty good. I was going to ask you what the outcomes have been on your supplements or just turmeric in general, and how long does it take once you start supplementing to start really seeing the benefits of it?
And it varies, right, depending on the condition. Like someone who has a chronic inflammatory disorder or autoimmune disease, such as rheumatoid, fibromyalgia, or even lupus, it can take up to 2 to 3 months. Someone who has mild osteoarthritis, we've had patients after a week to 2 weeks, right, being consistent. And it is something you should be consistent with. And I want to, and brings me to my next point, is that the biggest misconception is, well, I'll take it when I need it. It's not an Advil or a Tylenol. We're looking at taking this on a daily basis forever, and you can take a break if you wish. But we're also trying to minimize the number of supplement patients are taking. Like I wrote a chapter called Less is More, and we just find in general people are taking way too many supplements that they don't need. So we talk about get your vitamins and other nutrients from your foods, but certain things you can't. So what we've been really teaching patients and consumers is that focus on the antioxidant and anti-inflammatory profile. So we've been able to bring patients from 15 or 20 supplements to 3 or 4. And so that's all. Again, anything that we release as part of our product lineup is based on reducing oxidation, like free radicals and inflammation. And so with the turmeric supplement, again, it's really something that should be taken daily, even if you don't have pain or inflammation. It is a very good preventative protocol to be added to your regimen. Mm-hmm. And we know that, and most people they don't tie in inflammation to immunity. And so, well, if you can keep your inflammation down, the immune system goes up, and you really help strengthen the immune system by taking a daily full spectrum turmeric supplement.
Yeah, I feel like it's made a huge difference for me. What I want to talk with you about is a couple different things. We focus on the inflammation aspect of it. When I first really heard about it was from a patient who had breast cancer, right, and had been treated at, like, I think the Mayo Clinic, some big place. And she was in remission or whatever. And she said, like, the lead guy, the chief guy, put her on turmeric and said, take it for the rest of your life.
Yes.
And I thought you could talk about cancer in itself and how it can prevent it or help it. I mean, I feel like that is so huge, and it's one of my biggest fears.
Well, and and we know it's one of the biggest topics these days, and these stats are pretty scary. 1 in 3 Canadians, and it went from 1 in 6 to 1 in 3. And if you look at India, for example, is that where they take the most turmeric as part of their daily regimen, their cancer rates are one of the lowest, including pancreatic, prostate, and breast, and liver, and so on and so forth. And so this is, again, going back to the inflammatory aspect, is that this is one of the diseases that goes back to inflammation. So low grade persistent, and most cancers, as we know, they develop slowly. Well, the same thing with inflammation. Nobody says I feel inflamed. And so until something actually happens. And so what the inflammatory process does, and going back to these cytokines, these inflammatory chemicals, is that you have this signal that never stops. And so that's what essentially causes the growth and replication of cancer cells. And we all have cancer cells, but it's in those patients or people where the cancer cells keep replicating. Inflammation does that, and it'll cause more and more replication and growth of tumors as well. Well, turmeric and curcumin specifically in studies have shown to help stop that process. And we're not saying that this has nothing to do with curing, it's preventing, again, going back to the preventative aspect. In fact, there was a study where they combined curcumin to tamoxifen, which is a chemotherapy drug. And what they showed in the study is that the number of cancer cells killed increased when you added curcumin as well. So it's going back to how can we stop replication of these cells? How can we stop that trigger for the growth of these cancers as well? I mean, ongoing research is required, obviously, but there's over 1,000 studies when it talks about the cancer studies in turmeric. But again, it goes back to prevention, keeping the inflammatory levels down. The more inflammation, and that really is the scariest part, is it's one thing to have muscle and joint pain, but when you start going systemic, that really is pretty fearful.
It's awful.
Yes.
I want to talk also. I read up on your website, which is really helpful actually, because you have a great blog. You talk a lot about these things that we're talking about. And I feel like they're straight to the point. It's just so important to know this stuff. I want to talk about menopause.
Okay.
And because honestly, as a woman, you're going to go there. And I had a patient tell me that she was put on it for hot flashes. So I would just love for you to talk about the effects of turmeric on menopause. How it could be beneficial.
I spoke about this a couple of months ago, actually, and it's a very interesting topic. And I learned a lot as well, from doing my research on menopause. And again, it goes back to, hot flashes really is a sign of inflammation, and so and hormonal fluctuation. And it goes back to the liver function as well. Well, the liver's function is to get rid of excess hormones as well, and so we found that in certain studies that turmeric can really help balance out hormones as well as a natural phytoestrogen, and keep the liver function at bay as well. And so it essentially helps the liver in balancing the hormonal fluctuation and decreasing, and the inflammatory levels will increase during menopause. And this is why one of the first recommendations is turmeric or curcumin, because it really helps to create balance in the endocrine system. And so it's twofold, the anti-inflammatory component and helping with liver function as well.
That is so important to know, honestly. And I read in your blog, you talk about how in menopause, estrogen decreases, obviously, but you mentioned also that serotonin and dopamine decrease. And so you can see how you get some of these mood changes and all of these things that are happening to us during menopause. So
That's right.
Yeah, I can see how it's so important to supplement with this. And I think more women need to know that. I mean, it's awful to just suffer through those things if you have something that can prevent it,
Well, and you also, and the biggest misconception is that we have female patients who are going through menopause. Oh my God, it's a spice. I think it's to create more hot flashes, right? That's the biggest. I mean, if you eat raw turmeric in high levels, that might do that.
Okay.
But this is, again, going back to why it's so important to take in a supplement form, because it's controlled release as well. You're not going to have this profound effect all at once. And you look at our supplements the technology we use allows it to be released slowly, so a sustained release manner, and it's in your bloodstream longer, so it has it's in that therapeutic window for a longer period. If you take something, whether it's in its food or raw form, or a supplement where you get quick absorption but it gets excreted quickly, it's harder on your system. So when you go the full spectrum turmeric supplement where it gets released slowly, it's much easier in your system, and you won't have those other side effects as well, whether it's gastritis or
Are you there?
Or whether it's hormonal cutting. Better?
I think we
So
cut out.
this is where
Are you there?
Did we cut out? Okay.
Yeah. Start over a little bit about why because I'll probably cut that out and just talk, go back over that because I feel like it's important about the slow release.
Yes. Sorry. Yeah. Now,
are you in Canada?
I think it's maybe my internet.
Okay.
I am.
Okay, that's wild.
Is that better now?
I think so. Yeah. Try again.
Yeah. All right. So, so this better or still cutting out?
Yeah, I think it's a little better.
So we made it our objective to develop a technology that allows for sustained release of the turmeric and all of its other nutrients in the capsule. Because the problem with most of the supplements is that they might get quickly absorbed, but they also get excreted very quickly, which is harder in the system. And so the longer something is in your bloodstream, the better it is. And as we know, from a therapeutic perspective, is that you want it longer in your system, in that therapeutic window, which, then, prevents any other side effects or less irritation to the system. And so with ours is that it gets in 2 to 3 times faster, but it's in your bloodstream up to 24 hours. So it's working around the clock. And so with menopause specifically, you don't have these spikes, which is easier on the hormonal system. And this is how it's able to control, symptoms such as hot flashes over a longer period of time as well. And so in going with a full spectrum with controlled release factor is that you're taking less with a greater effect.
Okay.
So you're not bombarding your system as well with all these. So instead of taking 5 or 6 capsules, you're taking 2 of ours, which is also sustained release. And everything we do, any other products that we have developed is based on this technology. And one thing we just developed is called Polyshield. I'm not sure if you read that on my website. So Polyshield technology, we've been working on for the last 5 years. We want to develop a natural delivery system based on pomegranate peel. And we found that extracting polyphenols from fruit peel, specifically pomegranate, because it has a high level of these polyphenols, which essentially are antioxidants, they act as a very good stabilizer and protector of these nutrients. So there's less of breakdown in the liver with the first pass metabolism. But the beauty of it is that you have a natural delivery system, which are antioxidants essentially, but it also acts as a prebiotic. So it's creating good gut bacteria as well and very good for menopause as well.
Is the Polyshield the technology, or is that
technology?
That's the technology of it. Because I was going to ask you what the difference is, because there's so many supplements. It's really overwhelming, actually.
Right.
And so I was going to ask you really what the difference of yours was. So it's basically the extraction and how you create the supplement.
Well, that's just it, because when you look at anyone can take turmeric root, ground it down to a powder and put into a capsule, but that's not really, there's no technology behind it. And so when you just put powder into a capsule, that's not really an advanced extraction process. We started off making sure that we're using an advanced extraction method to make sure we get everything out of that root, but also make it more absorbable. Then we discovered that fruit peel, and people have used orange peel and other types of fruit peels, but specifically the pomegranate peel, it actually accounts for 60% of the fruit's antioxidants. And it's been used in the food industry, but we found that and on my website we explain it a little more in detail with an animated video. But we found that it works as a very good stabilizer, and it encapsulates, so it actually helps bring in these nutrients much more efficiently. And the other benefit is that as it goes through the liver and the kidneys, it actually helps the organs, as opposed to a synthetic delivery system like nanotechnology or even liposomes. And we keep hearing about these liposomes.
Yeah.
Where a lot of these systems are synthetically made, where this is all natural. It's unheard of. We are the first technology in the world to introduce a natural delivery system that's actually from start to finish beneficial to the human body.
That's awesome.
Yeah. So thank you.
Yeah.
So
it has to feel so good, like so rewarding to do that.
It's been keeping me up at night. This has been my mission for years, and we've been looking at polyphenols. In fact, I'm on to my next book. Would most likely be called The Powers in the Peel. We want people to understand that the this whole peel phenomenon is just, I think it will change the vitamin and mineral industry forever. Nothing has been done, and I'm glad you made that comment about there's so many supplements out there, but there isn't enough science.
Mm.
And my question has always been, how much are you actually absorbing? Do we really know that? And so, and how many companies can provide that data? Well, we can. So, but again, anything we do, we want to make sure that the consumer is benefiting from the entire supplement, and by creating superior absorption, but also again that sustained release factor. And from start to finish, you have a very healthy supplement.
Mm.
So
Yeah,
most
that's
supplements
huge.
we know, if you take your standard, capsule, by the time it goes through the liver, you're probably absorbing between 30 and 40%. But we're increasing our absorption to 80 to 90% absorption. And so you're having a greater effect again by taking less. And so this
And
is
you
the
think
thought.
about the money that you're spending on these supplements and not absorbing much of it.
Exactly. And and earlier on in my career, you had, people saying, well, I think it's working because, my urine is bright yellow, taking, let's say, a B complex,
Yeah.
not knowing that you're just excreting it, and they're just taking way too much when they don't need that much. And you have people taking 10,000 IUs of vitamin D and C, they're on, 5, 10,000. They're just bombarding their system. Is that this is why, again, and I keep emphasizing less is more. Be nice to your system, is that because the more you take, you actually might creating more inflammation. And so everything we take, as we know, has to go through the liver. And the more it has to process, the worse it is for the liver.
I'm so glad you said that because you don't think about supplements that you're taking causing inflammation
Right,
or the work it's putting on the liver by
right.
taking all these different things. I mean, that's such a good point.
And this is something that's not really talked about much, and it really should be,
No.
because, you know, with any of our our, whether it's the liver or the kidneys, the more stress we put on them, well, the more inflammation we're going to create, right? And
Yeah.
so try to minimize what you're taking, and again, focus on not just absorption, but what it's actually doing to the liver. You look
Mm.
at technology called Polyshield, pomegranate. We know the benefits of pomegranate, and we're taking it from the peel, which as it's actually getting broken down, it's helping the liver, it's helping the kidneys, and it has more than just the more than just the delivery system aspect of it. It's actually providing antioxidants. And
Yeah.
so again, going back to the whole free radical aspect.
Yeah, that's awesome. That's great. Well, before we move on to vitamin D, which is huge, is there anything else
Yes.
that you feel so important to know about turmeric that we didn't cover? I know you wrote the whole book on it. So is there
Yeah.
anything else that you feel is important to talk about on that?
Well, I think I can't stress it enough that, when choosing a turmeric supplement to go the full spectrum, we've done many, many years, over 7 to 8 years of research on turmeric. And I have to say, I'm very pleased at where we have arrived with the supplement. Is that I've met with so many scientists across the globe. And I think this is it's going to become more and more popular, and such a big necessity to implement in daily regimen. And that's one thing I really want to emphasize again is, please implement it into your daily regimen, not just as you need it. And it
Mm.
can really help decrease inflammatory levels. And again, and going back to the curcumin turmeric question, is that again, full spectrum where you should be combining turmeric and curcumin. That's really the one of the most important points. And the other thing I should mention is that, which also misconception, is the black pepper. And I'm sure we get this question almost daily. Is, well, I heard yours doesn't have black pepper, and I heard to absorb you need black pepper. That's old technology.
Mm.
And so we wanted to develop a system where we didn't need to add any other additives such as black pepper or other liposomes and so on and so forth. So by using this advanced extraction process and the Polyshield, is that we didn't have to use anything that will affect the liver. We actually found that there's a process called glucuronidation, that black pepper glucuronidation is how the liver detoxifies.
Mm.
Well, black pepper, and my question was always, well, how does black pepper increase absorption of piperine, which is the name of black pepper? Well, it actually helps slow down liver detoxification, which you don't want. And
Oh,
so we found that, well, let's try to, and it's I think it's worked well. It's just we want to find a newer way, a more of an enhanced way to be nice to the liver and still able to increase absorption at higher levels. So we found that this was the superior way.
wow. I'm so glad you talked about that, because I've definitely have seen that in the supplements I had patients tell me. I had a patient the other day tell me he takes turmeric powder, apple cider vinegar, puts pepper in there,
Yeah.
something else, Metamucil, mixes it
Oh,
all
wow.
together and drinks it. I'm like, I don't know if I could go there with that. I don't
The
know
great
about that
concoction.
one.
And
Yeah,
the
I
thing,
know. I'm like,
this is why education is so important, is
yeah.
that there is a lot of misconceptions out there. But, I think that we want it to be at the forefront here. We want to be the educators of turmeric to really, to clear up any confusion, is that you don't need the old technology, is that, the supplements can work way more efficiently and at a higher level by using less additives. So and I just did a blog a couple of days ago on why no black pepper. So the long story short, no, you do not need black pepper with new technology when you're taking a full spectrum.
That's so good to know. Thank you. Well, let's dive into vitamin D. I
Okay.
wanted you to talk about why it's so important, and maybe why ways we can tell we are D deficient.
hmm So first of all, it's most of the population is probably don't have optimal levels of D. Why? We'll start off with why it's so important. Well, vitamin D, first of all, it's a hormone, as we know, and it's important for overall bodily functions. And so we talked about hormones as well, right? And that it's a very good balancer as well. But its main claim to fame is bone density, maintaining proper bone health, immune function. That's one thing that most people didn't realize, that they were taking it, and only if you had weak bone density. But it does maintain optimal bone mass, as well as improving immune function as well. Now, one thing we're seeing in patients is that especially in the winter months, is that they're feeling more fatigued, and they're getting sick more often. And obviously the best ways to find out if you're D deficient is the blood analysis, which will show it clearly. But also bone density. And we find that women, in particular over the age of 35, should really be increasing their vitamin D, because their bone density will decrease, and they'll be diagnosed with things like osteopenia and so on and so forth. So it's something that we should be on. And that's another misconception. Say, well, I'll only take it in the winter months. Well, no, because even if you're out every day, not everyone converts properly, and they're not producing enough vitamin D. And there's many factors as well. So that's why it's important to be on a D3, which is actually cholecalciferol, which is actually the better form of vitamin D, because it's more absorbable. But what we've done, and another very important point when taking vitamin D, is to add K2 to it. So vitamin K2 helps with the absorption of vitamin D. It also helps with the absorption of calcium into the bone matrix. So yes, you can have high levels of vitamin D, but you may not be increasing your calcium absorption. K2 helps with that, but it's also good for heart health overall. So by combining these two vitamins, essentially you're covering a wide array of different benefits and systems. So you're helping your bone density, immune system, heart health, and even brain health as well.
Mm. I wanted you to talk about, you mentioned the K2, and I wanted to get into that. So talk real quick about I have a lot of patients that just supplement with D3. What happens really, you talk about the calcium, but help us understand what happens if you just supplement with D3? What is happening to the calcium, and where is it going?
Mm-hmm. Very good question. And I think there are quite a few patients that just do well with D3, but it really all depends on, how well their body and their bones are absorbing the calcium. So, vitamin D, again, helps with the absorption of calcium into the bloodstream, but is the calcium actually getting absorbed into the bones? So you might be absorbing calcium and then it's disposed in the bloodstream and then it gets excreted. And so, and the other concern is that does that calcium get deposited into the blood vessels, right? Creating plaque buildup and so on and so forth. What decay does, it helps take it out of the blood and bring it into the bone matrix, which therefore increases bone density, making sure, and that's where it goes back to cardiovascular health, is to make sure that we don't have any more calcification into the blood vessels and we absorb that calcium where it needs to go.
Mm-hmm. With the K2, clarify this because, people associate K often with blood clotting and, you should avoid it if you're on a blood thinner, but the K2 is different. And explain that a little bit if you can. And then is there anybody that should not be taking the K2 aspect of it?
Well, we still, even, being a Health Canada approved product is that we still have to have it part of our caution statement because that's really how it prevents, cardiovascular disease and heart attacks and plaque buildup. Again, similar to turmeric, but it's not as powerful as a blood thinner as turmeric is. But I would still raise caution that anyone who's on blood thinner should still check with their physician whether they can be on K2 as well. But that combination of K2, D3, again, most people are on it even if they're on blood thinners. But again, I would still suggest and highly recommend that they check with their physician. And again, it goes back to, well, if they're on a blood thinner, are they on a high dose? Are they prescription meds, or they're just taking an aspirin as preventative? But again, just to be safe, I would just check with their medical doctor because we do know that you'll have more benefit taking the K2 with the D3.
Okay. I've had patients tell me, I've talked about D3. I'm like, always like, hey, D, and, I get plenty from the sun or I eat a lot of, fortified milk or whatever.
Right.
Why is that not enough?
Again, it's how it gets converted, and so you look at, yes, there's a lot of foods that have vitamins and other minerals, but are we actually absorbing? Are you getting enough of it? And the short answer is no. And and there's different other confounding variables that really prevent conversion, even from vitamin D from the sun. You may not convert enough of it. And even if you do, are you absorbing? Are you getting enough of it? And so you look at, the nanomoles, which is how they're measured in the bloodstream, is that most patients are between 30 and 50 when it should be well over 75. And so this is why supplementing, and this is what we're trying to educate the public, is that, no, you should be on it, every day, and all year, not just during the winter months. So what I will say is, to that point, is that we don't have to be on so much unless someone has osteoporosis or any other bone disease where they've been prescribed a higher form of vitamin D3. But I think taking between 1,000 to 2,000 units and international units per day is sufficient.
I was going to ask you how much to start with. And then do you have people routinely check their levels? At one point I heard somebody say levels aren't important anymore, but you still feel like it's crucial?
I think they are. I think they're, because it's sort of a good preventative marker as well. And that, take it as again, we have to sort of clear up the confusion as that it's not just for bone density. Okay, so when we get patients saying, well, I have good bones. Well, no, we're talking about the immune system. We're talking about heart health and brain health and so on and so forth. There's just much more, especially when you start taking with the K2. But I will say, and again, going back to the whole, minimizing and less is more, is that, you have patients that are just taking, between 5 and 10,000 IUs, which is just too much, and actually between 600 and 1,000 IUs as a good maintenance program is sufficient.
Really? Okay. That's good to know. When you talk about D, how should we be taking it? I know it's a fat soluble vitamin. So if you could just tell like what we should be taking it with, and when. Also, I heard that D can disrupt your sleep if you take it late. Is that right?
It can also give you some energy, right? I mean, you don't have too many people that, for me, I can take anything at night and I'll go to bed. So it doesn't have that effect, even coffee. But typically we say take it in the morning. And yes, because we've had, many patients tell us that it does disrupt their sleep, and then you have to take something to counteract. But I would say morning would be the best, with or without food. I typically take it with food for better absorption. But again, it's what we've done here with our D3 K2, we're releasing in the next 2 to 3 weeks with the Polyshield technology, and we just found that you're going to get already increased absorption with the K2. We want to bring it to the next level and have, again, that going back to the controlled release. We want to make sure that D3 and K2 stay in your bloodstream longer so you can have a better therapeutic effect, but also increase more of that calcium absorption as well.
I was going to ask you, if you take too much D, does it make you feel bad? Is there big side effects? I mean, how do you know other than the blood level?
The good thing is that, in order for us to overdose on D, it's quite hard. I mean, you have to be, I think it's between, they said 25 to 50,000 IUs per day, which really nobody's on. And so I know there's patients during COVID because the correlation there, there was speculation that there's a correlation between low vitamin D and COVID patients. And so, but again, 5,000 would be enough, but again, very difficult to go to those toxic levels of vitamin D.
I was reading some studies during the COVID about vitamin D, and I even read, as far as kids, we don't think about kids being D deficient. Right. And there were some studies that D in kids help prevent respiratory infections. I thought that was interesting and good to know.
Well, we're finding that, and I should say that one thing that I almost forgot to mention is that our turmeric supplement has been selected to be included in an autoimmune disease study at one of the universities in Canada. And what they're doing, they're actually combining turmeric, vitamin D3, and omegas.
Okay.
And they're finding that to be quite effective at decreasing inflammation, not just respiratory, but overall systemically. And that's one thing we've been doing already. So we've actually combined our turmeric with hemp seed oil, not just hemp, but hemp seed oil as the omega. And we found that by combining turmeric, hemp seed oil, and D3 and K2 seems to be the optimal regimen to keep inflammatory levels down quite a bit. And respiratory, again, which is a very important point, especially what's happening with COVID, and not just with COVID, but COPD, emphysema, and chronic respiratory diseases. It does specifically target respiratory inflammation.
Wow, that's huge. I was going to ask you, I'm glad you mentioned hemp seed oil, because I don't know much about it. And somebody asked me about it, and I really don't know much about it. So if you could just talk about that real quick and why it's important, and should we be supplementing with it?
I had a great experience with it, and one of my colleagues who's a chemist, got me onto it a couple of years ago, and and I kept thinking it was your hemp CBD. It's the same plant, but it comes from the seeds. And why it's so important is that you have so many people on fish oil, but we're finding now that the better alternative is hemp seed oil. So just as you would take fish oil for your omegas 3 and 6. You can substitute it with hemp seed oil. And why we find it to be much more beneficial, because it has the optimal ratio of 3 and 6. It has chlorophyll, which is anti-carcinogenic, vitamins and minerals. It has a high concentration of iron as well. So it's a full spectrum omega supplement, and it's free of mercury and peroxides that fish oil might have, even if it's trace amounts.
Right.
And so it's just a cleaner and more stable oil. So out of all the oils in the plant kingdom, it is the most therapeutic oil out there.
Wow.
And we found so earlier on, even without the turmeric supplement, most of our arthritic patients were reporting phenomenal results in joint and muscle pain, because it has a strong anti-inflammatory component with it. Because of that, and as you know, that what's required in an omega supplement is that if you don't have the optimal ratio between 3 and 6, well, then inflammatory levels can actually go up.
Oh. So
they found in studies that most of the chronic diseases in North America is a result of the insufficient omega levels between 3 and 6. There's way too much 6 that we're consuming, which is pro-inflammatory.
Right.
So they went back to a lot of the heart specialists were saying, well, you need to be on a supplement that has a very good balance between 3 and 6, and hemp seed oil has the perfect ratio.
So, do you have that supplement then?
We sure do. Yeah. So if you look at our website, it's called Dr. D's Pure Hemp Seed Oil, and there's nothing added to it. It's extracted at optimal temperatures. And we only press on demand, so we don't keep it in the shelf for long. And it's only 1 tablespoon a day, which gives you enough omega 3s and 6. It also has 7 and 9. But one thing, going back to menopause, which I think you'll find is very interesting. So the chemist says to me, "Oh, and tell all your female patients it balances hormones." And so it has something called GLA, gamma linoleic acid,
Okay.
which is an omega that specifically helps with hormonal balancing. And so the other concern was, well, hemp seed oil doesn't have DHA, which is good for the brain, which fish oil has. Well, here's a surprise. Hemp seed oil has something called SDA, stearidonic acid, which we
Okay.
call the rising omega star. SDA converts into EPA, which then goes into DHA. So now we have most of our patients who are on fish oil and are switching to hemp seed oil.
Okay. So it's called SDA because I'm gonna look
Yes.
that up.
Yeah. So SDA. So if you actually look at our bottle on the site, we explain it, the SDA and GLA,
Okay.
something that is required that and most women are low on. They found that women who were low on GLA had more hormonal fluctuations, more hot flashes, but they
Wow.
also gained more weight. And women who had a higher level of GLA lost weight.
Wow.
So, and the confusion is you look at hemp seed oil and say, oh my God, look at all this fat, but it's all unsaturated fat. It's good fat. And so it has the proper ratios. You're not going to gain any weight off of it. And
Yeah.
that's what deterred patients to begin. Oh my God, it's actually very good fat. And because of the combination of those fats, the unsaturated with other minerals and vitamins and the other omegas, it really creates a nice balanced, rich source of essential fatty acids.
Yeah, I'm so glad you talked about that. That is so important. As I get near to that, I want to do everything possible. I just want to feel good. That's so
Right.
good to know. Did you say you have to take a tablespoon or
Tablespoon.
a teaspoon?
Tablespoon. A tablespoon.
Ta- Does it
Tablespoon.
taste okay? What's that like?
And that's the most common question. It's nutty flavor. So essentially, if you've ever had hemp seeds or hemp hearts, it's really just oil that's pressed from the seed. And so I actually like the taste very much so. It really is just a nutty flavor. For
Okay.
some people, they may not like the texture because it's oily. Now you can also consume hemp seed oil in a capsule. Excuse me. I prefer taking the liquid form,
Okay.
easily absorbable, cleanses the system as well. We have many patients who are inflammatory, who have inflammatory bowel disorders, love it because it really helps detoxify as well and keep the inflammatory levels down.
Okay.
And so you look at cardiovascular function, immune function, for nervous system function as well. It just has a wide array of different therapeutic effects. Go to your level to the next level.
Okay. Now, as far as your supplements go, do you offer like a subscription or can people just get it like auto refilled or how does that work?
They sure can, yeah. So we will actually very shortly. So we offer the products on Amazon as well, but
Okay.
we are going to be offering more programs on our own website. And
Okay.
the good thing about our website is that we're creating a lot more education, a lot more awareness, and we're updating blogs almost weekly. And so we want to make sure that the patient and consumer is fully informed, and so they
Mm,
have all the necessary information to make an informed decision.
okay. Tell us the name of your supplements again, just so that when we go to look it up on Amazon or at your website.
Yeah. So the brand is Dr. D's, and the supplements is the Tumeric is Ultra Bile Turmeric, and the hemp seed oil is the Dr. D's Pure Hemp Seed Oil. And we also have the D3 is launching very shortly, so we have a pre-order available at the moment, and it's Dr. D's Vitamin D3 plus K2 with Polyshield technology. And we also have anyone who needs a very good topical treatment. We have an enhanced roll-on known as Dr. D Super 7, and I call it Super 7 because it has 7 all-natural pain-relieving ingredients, all essential oils that work really, really well synergistic.
Oh, wow. That's awesome. I could have used that back in the day. I don't suffer like I did, thank God, but
And
man, it was rough. All right. So where
well,
can
and
people
it's great
find you?
because it's targeted pain relief.
It's what?
Okay, so the website is drdeeds.com. Sorry, the website is drdeeds.com. So it's spelled DOCTORDS.com, and you'll find all of the information there. And you'll also find my information there.
Okay. And then follow you on Instagram as well. You do some good informative little videos there as well
Thank
and
you.
little short blogs.
Yeah, they can follow me on Instagram at Dr. Fabio Stefano
Okay.
on
Awesome.
Instagram.
All right. Well,
Yeah.
last question. What do you hope to accomplish through all your work? I mean, what is the impact you want to have with your work?
When I first launched my research and products, my objective was to help as many people as possible across the globe. And so I've been trying to do whatever I do in clinic to really multiply that and amplify that across the globe, and to really help as many people as possible, and to create an optimal line of antioxidant and anti-inflammatory products, and to make sure that consumers are benefiting the most out of these supplements, and that provide them only with the highest quality supplementation.
Awesome. All right. Well, great. Thanks for talking, and thanks for all the valuable information. It's huge. This topic is so big, and I look forward to following you, and
Really
looking
is.
forward to your next book and all that good stuff. So good luck to you, and thank you for being here.
And I thank you for having me. And we can talk about this for hours, but again, it's always my pleasure educating, and we'll continue to educate as much as possible. And as research is conducted, we'll be releasing it as soon as it's available.
Awesome. All right. Thank you.
Thank you. Have a great day.
You too.